Your skin is composed of 3 layers. The outer layer, or epidermis, is made up of cells called keratinocytes. They begin to form at the bottom of the epidermis. They divide, pushing already formed cells upwards. By the time the cells reach the skin's surface, they are no longer alive. These are the dead skin cells we constantly shed. This process usually takes about 30 days. In psoriasis, it takes only 3 to 4. And instead of falling off, the dead cells pile up. Psoriasis results from a problem with a type of white blood cell in the immune system called a T cell. T cells normally detect and fight off foreign substances. In psoriasis, T cells attack healthy skin cells and trigger an immune response. Blood vessels in the skin get larger. Other white blood cells enter the epidermis. The T cells release messenger chemicals called cytokines, which tell the keratinocytes to reproduce and mature much faster than normal. New skin cells form and move to the surface too quickly. They build up as the thick, scaly patches on the skin's surface that characterize psoriasis.
Well, psoriasis is an inflammatory condition of the skin. It's common. It's most common in young adults and older adults, though it can even occur in children. It occurs because the rate of replication of the skin is speeded up. So in the normal situation, the skin turns over in about 21 days, and that's 7 times speeded up in psoriasis. That leads to the appearance of psoriasis, red scaly patches, with the scale constantly dropping off, which is one of the reasons people get upset by psoriasis, because the skin is scaling all the time. These red patches with scale on the surface are called plaques. Well, there are several different types of psoriasis. These different types of psoriasis will be described later in the DVD. Well, the causes of psoriasis are interesting. I think the one basic thing you can say is that genetics are very important. And in any individual who has psoriasis, there is in 1/3 of people a family history of psoriasis. Now, if one parent has psoriasis, the chances of that person's children having the same condition would be 1 in 4. If both parents have psoriasis, the chances increase to 2 out of 3 of the children. So genetics would be fairly basic. There are other factors which then can be superimposed. For example, psoriasis can be precipitated by throat infections, in particular streptococcal infection. And that can lead to a type of psoriasis, a spotty type of psoriasis, which is called guttate psoriasis, and it has a good outcome. Trauma or scratching can make psoriasis worse as well, and often leads to persistent patches of psoriasis. And then there are a number of other causes. Certain drugs can make psoriasis worse or can bring out psoriasis for the first time. Well, there's no doubt that stress is a major trigger factor for psoriasis, and some people handle stress better than others. But if you are in a stressful situation, psoriasis tends to get worse. Climate can be very important, and as you know, most people who have psoriasis find sunshine helpful. But quite a number of people, perhaps as many as 12%, can find that ultraviolet radiation makes psoriasis worse. And that seems to be more important in very fair-skinned individuals. Another major factor which is good to know about is alcohol consumption. So excessive consumption of alcohol can really make psoriasis worse, and we normally advise people to keep their consumption of alcohol very minimal. And finally, tobacco. Smoking can make certain types of psoriasis worse, particularly psoriasis on the hands and feet. Well, I think, psoriasis can be a very mild disease. And if you have minimal psoriasis in a hidden place and it doesn't itch, the impact might be almost nothing. But if you have more extensive psoriasis on visible sites, it depends on your viewpoint, but if you have psoriasis on your face or in places, for example your hands, where you're interacting with people, it can be devastating and it can be socially paralyzing. Also, if your psoriasis is itchy, and it can be quite itchy in many people, if you can't sleep properly and if you're constantly itching, psoriasis can make you completely miserable. You could have localized psoriasis in a visible site that was very disabling, for example, on fingers, and it might stop you doing your job. So I think you'd have to really take the personal circumstances of each person into account before making a judgment about how much that individual psoriasis will impact on their lives. I think it's important to say that psoriasis is not an infectious condition.
Types of psoriasis. There are several different types of psoriasis. The most common forms of psoriasis are plaque psoriasis and guttate psoriasis. Psoriasis can appear anywhere on the body, but commonly affects the elbows, knees, torso, and scalp. Plaque psoriasis. This type of psoriasis is characterized by well-defined, disc-shaped salmon pink to red plaques covered by silvery white scales and most commonly occurs on elbows, knees, and scalp. 80 to 90% of all psoriasis patients suffer from plaque psoriasis. Guttate psoriasis. This type of psoriasis is characterized by small, raindrop-like areas of dry red plaques, usually on trunk and limbs. This form mostly occurs in adolescents or young adults and may follow a streptococcal throat infection. It usually occurs as a single episode, which is temporary. 3 less common types of psoriasis are flexular, pustular, and erythrodermic psoriasis. Flexular psoriasis. This type of psoriasis is characterized by smooth glazed plaques which occur in folds or flexures of skin, such as the armpits, groin, skin under the breast, or between the buttocks. Genital psoriasis occurs in a third of patients. This form of psoriasis can sometimes be confused with other types of skin conditions, such as fungal infections. Pustular psoriasis. This type of psoriasis is characterized by redness, scaling, and pustules, normally affecting the palms and feet. However, in rare cases, large areas of the body can be affected. Erythrodermic psoriasis. This severe form of psoriasis is very rare. The psoriasis can spread to cover the entire skin, resulting in the need for hospitalization. Other features of psoriasis. Nail psoriasis is seen in 25 to 50% of patients and is more common in older patients. Nail changes include pitting, small indentations on the nail, and separation from the nail bed. Psoriatic arthritis affects 6 to 10% of the psoriasis sufferers. It can be confused with other forms of arthritis, but it is rarely debilitating. Scalp psoriasis affects 50% of psoriasis sufferers. The scalp may be the only site affected and therefore can be confused with dandruff. People with mild scalp psoriasis will have dry and flaky scalps, while those with more severe scalp psoriasis will have large plaques with thick scale.
How to treat psoriasis. Though you can treat and control psoriasis, characterized by dry, scaly patches of skin, the progress is often erratic and cyclical, so be patient and consistent in executing these steps. You will need a doctor, topical corticosteroids, salicylic acid, mineral oil, coal tar soap or shampoo, bath oil, colloidal oatmeal, bath salts, ointment-based moisturizer, ultraviolet light, sunshine, laser therapy, oral or injected prescription drugs, and plastic wrap. Step 1. See a doctor about prescription topical corticosteroids for mild to moderate psoriasis. Your doctor may advise limiting their use until the outbreak is under control. Over time, your skin can become resistant to traditional treatments. Consult a doctor before using more aggressive treatments. Step 2. Use over-the-counter and diluted salicylic acid with mineral oil, and then wash it off with a coal tar soap or shampoo. Step 3. Avoid washing too much or otherwise drying out your skin. When you bathe, use bath oil or colloidal oatmeal and bath salts. Dry thoroughly, blotting carefully with a thick towel. Step 4. Apply an ointment-based moisturizer that can control the itch. Avoid cold weather, which can also irritate and worsen the condition. Dermatologists sometimes use rotational therapies, alternating months of psoriasis drugs and creams to minimize damaging side effects. Step 5. Expose the area to brief ultraviolet light therapy, which can slow down the cell turnover and reduce scaling. Natural sunlight is good, but less controllable, so it can worsen psoriasis. Step 6. Undergo laser therapy, which targets only the involved skin patch and eliminates plaques that cause the psoriasis inflammation. Calm your life down, refusing to allow yourself to be ruled by emotions that can exacerbate the psoriasis. Step 7. Take prescription oral or injected drugs, but advisedly, as there can be severe side effects such as life-threatening infections. Step 8. Moisturize at night and cover the psoriasis with plastic wrap. In the morning, remove it and clean away scales, but always avoid cleaning with alcohol. Did you know? It's estimated that up to 125 million people worldwide have psoriasis.